Hi, I'm excited to share with you the Traumatic Brain Injury Toolkit for School Nurses, which has just been updated and is up on our BrainLinks website. We're going to talk first about why concussions are worth identifying and treating and monitoring, because they are often kind of treated as not a big deal, and they really can be. We'll talk about screening for prior history. We'll talk about the new toolkit, and then I'll kind of give you some suggestions for a protocol within the school system. So brain injury, they say that there's a brain injury every 9 seconds in the United States. There are more than 3.6 million people that sustain an acquired brain injury each year. We know that that number is low because it does not seem to take into account the number of overdose survivals there are from substance abuse, and those people, many of them will have a brain injury from an anoxic or lack of oxygen injury. At least 2.8 million people sustain a traumatic brain injury each year. We know that that number is low as well because it doesn't include the emergency departments. It is only pretty much the emergency departments and doesn't include people who go to their doctor, also doesn't include veterans. So we really don't know the total number. A number that we use here in Tennessee is about 68 people experience a traumatic brain injury each day, and that by the end of the year, here in the Nashville area, we have the Bridgestone Arena where the Predators hockey team plays, and that would be standing room only by the end of the year if all of those people were put in that arena. At least 5.3 million Americans live with a traumatic brain injury related disability, and that's 1 in every 60 people. Again, that doesn't include acquired injuries, which is also things like stroke and brain tumors and overdoses and things like that. So let me give you, I want to give you 2 cases that are very, very common for us at BrainLinks. One is a child that is injured early, and then we look at them not that long later. So this is not a concussion injury. This is Zach. This is actually several students pulled together, or young children. They're in a big accident. ATV accidents are big here in Tennessee. They do have a loss of consciousness. There are multiple skull and brain fractures. This is a big deal injury, but they recover beautifully, as really most of them do. Everything physical goes away, all the scratches and the bruising. And if the brain hasn't caused some sort of movement disorder or something like that, then there's nothing to see. However, just jump a few months later and we see that they're failing kindergarten. They're disruptive in the classroom. They're impulsive. They're not identified as having a traumatic brain injury, even though, because this was a big deal, there were many people in the community who knew about it, but it's just not carried over into the school. And they're often identified as just a boy being a boy, or they have attentional problems, and it really is more than that. Let me give you another example of when someone is injured young, and then we jump a couple of decades later. And this, we usually hear of people like Nathan from their parents who comes to watch one of our trainings and says, hey, you were talking about my child. So they were injured young. It might be falling down a flight of steps, could be falling out of a parent's arms. We've heard falling out of a second-story window. It could be an ATV accident where the child was being held. They're crying. There's no loss of consciousness. They've seen at the hospital and they say, oh, there was no concussion. There's no recommendations, or maybe there are recommendations just to watch that child for a little while. Bruising for weeks. Jump to age 24, and now we see all of these other comorbidities coming in. We see that they have been in prison. They're an addict. They've tried everything, because what they're trying to do is make their brain feel normal again. So they're like, maybe this will work. Maybe this will work. Maybe this will work. They can't hold a job, or maybe they won't hold a job. It's hard to say. They're often labeled as very smart, but they struggled in school. They don't have a lot of friends. And then they have some sort of mental health issue that they're dealing with as well. And usually at this point, we'll say, this is great, we can help you, there are some things that we can do, some places we can go for help, or even just educating the child about it. And they'll say, oh, he won't get help at this point because it's just the way they feel like they are. So this talk is not to talk about what a concussion is or what a traumatic brain injury is. You can go to the video on what is a concussion for that. Two great studies that show the changes that even a concussion level, a mild traumatic brain injury, can have on children, students. So when they're injured with, again, just I say just, but we can see from the outcome it's not really just, but a mild traumatic brain injury in preschool, then we jump to ages 14 to 16, we see that they have more ADD, ADHD, conduct disorder and oppositional defiance, substance use, mood disorder. Another study looked at the concussion in childhood up to age 16 and then jumped about a decade to 21 to 25. And we see that they're more likely to abuse substances, commit violent and personal property offenses. So these things that are looked at as not a big deal really can change the trajectory of a student's life. It's also associated with lower educational attainment in school, more substance abuse. Like we said, this is just more studies saying some of the same things, not great interpersonal skills, the increased risk of psychopathology, antisocial behavior, and aggression. We also see that if someone has had one injury, they are much more likely to have another, and then much more likely to have another. So we have to be keeping them safe. They're more likely to become obese, to become incarcerated, to abuse substances. Again, that comes up, become depressed, be socially isolated. So we need to be screening for prior history of brain injury when students come into school, because they may have had an injury already. We're kind of geared toward looking for the injuries that happen during school time, but we need to be looking for ones that have happened before they even entered school, or maybe they came from another school. So this is a great one to use because it includes acquired brain injury as well, things like stroke, loss of oxygen, infection, brain tumor, brain surgery. It asks questions about those. So that is a great one to use. You can also use the HELPS, which is a little bit more easier, I think, to send home to parents. Does include acquired brain injury as well, and it's very quick. If you feel like we can't do that, we can't send that home, or we can't be taking that extra time to be reviewing all of those, then really that's the thing that we recommend. But instead you can add some questions at least to your health history. Please do that. So you can ask things like, has your child had a head injury, cause of the injury, and you can put some things for them to choose. If they did they lose consciousness or become dazed? And then there's an opportunity to write in more. So you can get an idea. Now, the downside of doing just this is that very often parents need to be asked, and even people who have had the injury need to be asked several times in several different ways before they'll remember, because it's really something that gets put into the past. It's not a big deal. Everybody recovered. It's all good. And then sometimes, unfortunately, if the parent had some role in it, they kind of just want to put it behind and say that there was nothing happened, there was no concussion, it was all fine, and that's understandable. So please download the toolkit. You can go to tndisability.org/school-nurses, and it is color coordinated in these colors. And you will see that there is now a communication with doctors section, and there's been some tweaks throughout. So we'll discuss those. So in office use, These two things remain the same. There's a symptom tracker that is great for tracking things, especially like a headache. Very easy to use. You can take a look at that. There's also, we recommend the CDC's signs and symptoms checklist for school nurses, and that can be used when a student is sent to you. Very easy to use. We also recommend using the concussion alert form. So right then, if someone has sustained a concussion, filling that out and adding it to their medical chart and their academic chart, or both. And it's very easy to use. It's just the section above the asterisks, and the main purpose is just letting you know that that there has been an injury, and that's it. It's not to bog you down in any additional paperwork. The send home recommended section contains, this is probably the most important document when concussion symptoms are not going away. I'll show you that in a moment. There are signs and symptoms tools I'll show you. This brain health document is also a great thing to send home for all students, but especially if someone has had some sort of trauma to their brain, knowing the right things to do to get that brain back on track can be very helpful. And there's a concussion and mental health infographic as well. Everything that we have produced is in Spanish as well. So this is an important thing to be sending home with parents initially when someone is, when a student is injured. The leftmost one, when concussion symptoms are not going away, it's for children who are 5 and under, and it goes through what you may see in them, and it also goes through how to engage with the early intervention system. Now, just to note, they have not been updated. They still have under 3. So you'll need to let the parents know that I believe we're under 5 years old. You can be seen by early intervention. It's still important to let parents know that often the first early intervention developmental screener does not pick up problems. It's often one a year later. So just because they pass doesn't mean they're in the clear. Parents should still keep an eye on them. The next one is for children who are school aged, and that goes into some of the similar things, but ways to engage with the school system. What is the special education system? What do you ask the school for? Things like that. And then the other one is for adults and college age students. Signs and symptoms tools. So these might be helpful. Really, I think the education, the one I just showed you on when concussion symptoms don't go away, is really important, because they will get into symptoms, but they'll also tell you what to do and what to be looking for. Signs and symptoms tools might be good to send home if you think maybe there was a concussion here, but maybe you haven't seen a lot of symptoms, but it was a big deal injury. So you might send this home just to have parents knowing what to look for and have them checked by their doctor. This is new. We added the concussions and mental health tool just because we're seeing so many mental health issues, and mental health is a big deal after a concussion, especially if you think about if they were in sports and losing that friend group can be really, really, really sad and cause anxiety and depression. So the new section, communication with doctors, it has the guidelines. So there were pediatric guidelines a few years back at this point, that came out for doctors. We include them here so that you know what the doctors are looking for, or what they're supposed to be doing. And we've included the link to that, and then we've included the supplemental documents that go along with that, because they're really easy to use. They're at a glance documents. They've taken it and they've condensed it and made it easy to use for diagnosis, prognosis, management, and treatment. We've included our concussion management protocol, I'll show you in a minute, and CDC's return to school letter. Our concussion protocol really was developed for the healthcare provider, the doctor, the PA, the NP, with them in mind, because the literature shows that there are lots of holes in how we treat people with concussions, and this is an attempt to fill in those holes. So we're asking healthcare providers to think of concussion as a 2-visit minimum visit to the doctor. So you come in initially for the diagnosis. We have the recommendations of the tools that they should be getting some educational material, and that is that when concussion symptoms aren't going away, so that they have it right away. Research has shown that's important. And then that they are having that student come back 4 weeks later if symptoms have not gone away. Now, if symptoms have gone away, then it's not that important, but we want to make sure that students are getting to a symptom specific specialist if symptoms haven't gone away. For most people, they will go away within 4 weeks. So if they haven't, we need to catch them so we can stop things from going beyond that. And then yearly checkups, they need to also be thinking and asking the parents about, have you seen any changes in academics, in behavior, in grades, in friends, in anything, mental health, because sometimes that's an indicator that the concussion did cause something greater. Why we want you to have this is not universally known or used by doctors at this point. So we want you to know to recommend that the parent go for that initial visit. They go back if by 4 weeks they haven't received, they haven't had all their symptoms go away. And that you can say, hey, maybe going to a neuro-ophthalmologist would be great for these vision symptoms. So you can suggest a place for the doctor to recommend sending the student. The CDC letter to the school. So we include this in your toolkit. Doctors should be sending this to you. If they're sending a version of it, that's perfectly fine. So many doctors have made their own version where they're talking about what the symptoms are that the student is experiencing, and then clearing them to go back to school. They can give you some accommodations that would be helpful as well. If you are not getting something like this from your doctors in your area, you can send this home with the family to take to the doctor. That's why we're including it here, so you get that back. All right, now in the supporting resources section, you all may be familiar with the fact sheet for school nurses. It's about 8 pages. It's the CDC's. They have put that out. We also have the 6 types of concussion fact sheet. I'll show you some school accommodations, the return to learn, return to play concussion guidelines for Tennessee. The CDC has an online concussion training for healthcare providers that has 2 free CEUs. It's a great training. I would check that out. We have a research summary and references that you can find all the support for all of this, and then changes to watch for over time. So let's look at a couple of these more in depth. The supporting, in the supporting resources, the 6 types of concussion infographic. The piece on the left there was developed by the University of Pittsburgh Medical Center. They have a great concussion center there. And it outlines 6 different types of concussion. Within the first week, you will just see kind of generalized. You're not going to see these 6 types. You'll see generalized symptoms like fatigue and confusion. Then that will kind of settle in, if you still have symptoms after that first week, to 1 or more of these different types or trajectories of concussion. And we see the cognitive fatigue, which impacts school a lot. You see the vestibular, the balance, ocular motor, which I think of as like watching a tennis game and having to move your eyes and keep up with something. Post-traumatic migraine. Cervical is when the neck is out of alignment. That can cause concussion-like symptoms. So we need to make sure that the spinal column gets put back into place. And then anxiety and mood. So anxiety and mood can be the primary symptomatology from the injury. So it doesn't have to be that it's a reaction to the injury. It can be, but it can also be that it's the primary symptomatology. On the right-hand side, you have We've put together a fact sheet that active treatment is helpful and some risk factors which may delay recovery. We love this tool from CBERT, the Center for Brain Injury Research and Training. It's on accommodations. It's up there in the corner. And it has on one side general categories of accommodations, their environment, their transitions, method of instruction, assistive technology. And on the other side, it has deficit-based. So if you know that they have a memory problem or a visual spatial or motor, there are some specific recommendations for accommodations. They're really kind of suggestions to prompt you into thinking about what would work best. The Return to Learn, Return to Play concussion guideline is in there from the state of Tennessee, and it gives guidance on returning to sport and physical activity as well as school. We have to have no remaining symptoms before returning to sport. We warn parents and other caregivers of the dangers of returning to sport while symptoms persist. Second impact syndrome can be catastrophic. That's when you have a second injury. It doesn't even have to be a big one, but you have a second injury while the brain is still recovering. And in children under age 24, their brain has a hard time dealing with that, and it can be catastrophic. And then we need to gradually increase participation and exertion day by day. And as long as no symptoms arise, then they can go back. So it's a 6-day gradual return to play. And it's detailed more in the concussion guidelines that show low activity and then gradually increasing with no symptoms. If you have symptoms, you have to return to the beginning and get rid of symptoms first and then increase activity and see what happens, because that activity often causes things like the headache to return or the vestibular issues to return. The new Return to Learn, Return to Play TSSAA form is there. It's been modified a little bit, probably 2 or 3 years ago. So that is in there as well, 2019 it says. So now we're into the optional section. So there are other great things that you can use for educating, and we wanted to give them to you, but not say, oh, hey, you really should send this home. This one that you see pictured here is really great for any children who are going into sports. It talks about what symptoms you might see on the field and symptoms that the athlete might report. So that's a great one to hand out at every new sports season to everybody. The CDC flyer for families is in there, the service coordination brochure, the Tennessee TBI services directory. So if you can't find a specialty that you're looking for referral, you can always reach out to us or the service coordinators. We may know somebody in your area. They try to keep it as up to date as they can, but things are always changing and people don't always they don't know to be in it. So it's not always everyone. There's a driving after traumatic brain injury, some things to consider. How do you return a student to driving? Brain injury and mental health. So we had the concussion and mental health, and now this is kind of a bigger, more moderate to severe injury and mental health infographic. There's a guide to possible changes I'll tell you about, and a resilience and brain fact sheet. So the service coordinators, there are 8 free service coordinators across the state. They are free service. They are amazing. They will help you to coordinate care. You should not direct everybody with a concussion there because they'll just be overwhelmed. But if it's more of a complicated case, if there are more issues involved, if the parent is having difficulty coordinating things, if you need some assistance finding some support, they're a great resource to go to. They also have virtual support groups and I believe still caregiver support groups. Okay, the guide to possible changes is recommended to be handed out if you have someone who has had a more significant injury and you just want to alert them of what to be looking for. So you might have someone return to your school after they've come from a brain injury rehab program. We know, unfortunately, that people will still have challenges in their lives, especially children as they age and as they grow. So there's one for young children. I love these two documents. They both have in them, if you flip them open, there's a chart that talks about what symptoms you might see and then what symptom specific specialist you might go to. So it gives a good, it gives that, I think, that idea that you can still get help. Just because you receive treatment once doesn't mean that's it. It might mean that's it for a little while, that we need to go back into life, try to use the strategies, encounter new challenges, and then get assistance with them. And sometimes if a new problem arrives that wasn't treated for, you can kind of tackle that. And there's one for the right-hand side is for school-aged children. Resilience in the Brain is a new document that mirrors our Resilience in the Brain training that we give, but it stands alone well too, just to give parents an idea of what kinds of things help to build resilience in our children. And if we build resilience, we build the brain. They go hand in hand. Build the brain, you've built resilience. So helps them develop resilience for brain health, physical health, mental health, and even longevity. If you're resilient and your brain is strong, you will live longer. That's related to some of the ACEs literature, the adverse childhood experiences. So the section for teachers and related services, we have a bunch of great tools there. This is our final section, I do believe. The brainstorming solutions tool, anything with an asterisk there, I'll tell you about. Strategies and accommodations tool, the personal guide for everyday living after concussion. That is great for helping families and maybe older students understand that a lot of the injury comes down to attention. If we can get a handle on attention, we can get a handle on a lot of other things. And kind of related to that is the building blocks of brain development, where you look at if you break out one of those bottom blocks, say attention or memory, the whole thing will fall down. So it's a great tool just to show related services and teachers that it's really not this achievement or this higher reasoning that's the problem. It's this building block on the bottom. And there is another one that shows one of those blocks pulled out and what happens. This CBER accommodations are in there as well. The TACT, the teacher acute concussions tool, pardon me, is in there. We'll talk about that and changes to watch for over time. So just a little bit about the brainstorming tool and the strategies and accommodations tools. They are great for your speech pathologists and your special educators. That'll give a template for what they're looking for cognitively, emotionally, behaviorally. It'll give an idea of how to think about strategies, internal and external. It's a great 4-page document. And then strategies and accommodation tool kind of maps onto that. Each area is covered. That gives suggestions of what you can use to accommodate for each area. And that can be used, or the CBER tool, or both can be used for accommodations. And then we talked about the accommodations tool. And so the teacher acute concussion tool, the TACT, is a great tool that the Tennessee Department of Health has paid for. It is free and it is fast, it is easy, and we want every teacher using it. They can sign on to it. Just contact us for the password. We couldn't leave the password here, but at TBI at tndisability.org, and have them sign up for it even before they have a student with a concussion, so that they have an idea of what it is. They'll get some sample fact sheets that will come to them. All they have to do is answer 6 quick questions. They'll get 5 emails over the next month, 1 right away, and then 4 over the next 4 weeks each week. And then they'll get some customized tools. It'll look like this when they go there. And you are free as school nurses to do that as well. We encourage you to do that, to sign on and to get the the information, because then you can pass that on if a teacher does not sign up. And you'll get these great fact sheets, these custom tip sheets on common things that students deal with in the classroom after a concussion. So worth doing. So this is, okay, this is just a suggested protocol. So you have all of this. Now what do? There are so many steps really that, and there's a lot of detail that we can get into that we're not going to. So don't take this as the be all end all. If your school has a protocol, then you need to use that, obviously, but you can have it officially modified if you feel like there are some steps that are not there. So in general, add concussion history questions to your health history form, or even better, use a lifetime history of TBI questionnaire. Designate a concussion team leader for each student that's injured. That does not have to be the school nurse. It could be the coach, it could be the teacher, but have someone who is point. Establish a communication system between the nurses, the physical education teachers, and the coaches. We often hear of that being a break in the link, where school nurses are not always notified about a concussion that happens on the field. If they are injured in school, then you need to screen using the CDC's concussion signs and symptoms checklist that's in the toolkit. Notify everyone, obviously the caregiver, the parent. Get to them by voice. Don't rely on a letter or an email, but get to them on the phone. Notify the teachers, the physical education teacher, the coach, and then send home in some form or fashion, email home, hard copies would be best, the educational materials that we are in the recommended section, the CDC letter for doctors as well. Remind teachers about the TACT and give them any educational materials that they may need. Add the concussion TBI alert form to the medical and academic charts. Again, it's really quick to fill out. And then follow the return to learn, return to play concussion guidelines. Monitor them for the next 4 weeks. Again, this doesn't have to be you. I know this can sound overwhelming as an already very busy school nurse, but having someone monitor them over the next 4 weeks, making sure that symptoms go away. If symptoms don't go away, that's when we start to see real problems. So get them back to the doctor if symptoms don't go away. Suggest a symptom-specific referral. So if it looks like they need a physical therapist to help with vestibular issues, whatever it is, you can go ahead and say, do you think at this point this might be helpful? Monitor them over their academic career. Because of those studies that you saw where children have problems for many years, we need to monitor them the entire time. And if problems arise, remind the teachers of the injury. Remind them to use accommodations, refer them for testing if necessary, and then serve as an advocate in the 504 and IEP meetings. I know that school nurses are not always included. You don't always need to be included, but there are times when it's really helpful, and this might be a time where you can be a good advocate because you understand the medical part behind it. So if you have any questions about any of this, about implementing it within your class, your school, you can email me, wendy_e@tndisability.org. And if you wish to receive a certificate for having completed this, you can go ahead and fill out our 1-minute survey. Thanks so much for listening and for caring about our students with concussion.